Hello and welcome to my final project podcast. And for this assignment, I did a PowerPoint plan of care for Libby. And then this video will also be connected to that as well, just for me to give a little bit more in-depth explanation of the objectives that I see for Libby's plan of care going forward, and how I would attack this scenario if I was one of her care providers. So in my plan of care, I first had the steps to Libby's success, and they first started with an overview of case history. And just like any other client, that's what we would do in the beginning of our assessment and intake. So do an overview of case history, and then we'll go through the specific aspects of her case history. And then normally with the case history, we're also going to do our meeting with the multidisciplinary team. So all of the providers that offer services to Libby basically hold an IEP meeting to get information across professions and allow for optimal success within Libby's treatment plan. And then also I wanted to add in here the discussion of cultural and linguistic biases of the family and external environment compared to the practitioner's cultural and linguistic biases. And I think this is really important to note that everyone has biases, and by allowing oneself to come to terms with their own biases and understand what their biases are allows us to provide more in-depth care to our clients and patients that we see. So we'll go through a couple of aspects of bias in this plan of care as well. And then I have the creation of Libby's plan of care, and involvement of parents is very important. Parental involvement is everything when it comes to treating a child around Libby's age, so that's very important as well. And then begin the treatment plan, and then the prognosis for Libby's treatment going forward. So for Libby's case history, what I collected was that Libby was diagnosed with hearing loss late. She was diagnosed at 3 years old. Libby now mainly relies on lip reading, and the parents are pushing for more verbal spoken language compared to ASL. She did not qualify for a cochlear implant. And also to know, when we're diagnosed late, around 3 years old, we're also missing of the valuable language learning period and the first word around 1 year old. And then the progression after that, the flood of words after the 1 year mark is outstanding for the normal realm of development. So noting that she missed very valuable language learning opportunities also brings into consideration the language assessment for verbal and written language to understand where she lands in comparison to her age in the norm of development. Again, she was late to diagnosis, so it can't hurt to do a couple formal and informal assessments just to see where she lands. I know that the parents are also pushing for more of spoken language, so allowing an assessment to come forward and kind of give us more clarity on where we're at would be a really good concept to touch on. She also uses hearing aids. I understand that Libby did not necessarily enjoy using the hearing aids. And she gets very emotional very easily. So it's important that I feel like we touch on some socio-emotional factors of Libby's development as well, which will be talked about later in this video. She has received ASL services and language services. She has her nanny who looks after her, who is teaching her ASL, and has actually seen some progression with that as well. But we seem to have some conflict with parental involvement within ASL, so we'll be also touching on that. Not receiving services at school that we have known, but pushing for services can allow for a better transfer of communication across environments. Again, minimal data on progress, hearing capabilities, language progress, and ASL progress. So allowing that multidisciplinary team meeting, that IEP meeting, will allow for data across professions to kind of come together to form the basis of our steps moving forward. I think is really important to kind of collect that valuable data and kind of baseline and get together as a team and build off of that baseline for Libby's progress. Again, the next slide that I have is, again, meeting with the team. I just have the parents first and foremost, an audiologist seeing where her hearing thresholds are at, the SLP assessments on language, verbal and written language, the ASL teacher seeing the progression with gross and fine motor movements within hand shapes and gestures, facial expressions, and overall signing of full words and sentences, I think is very important. Also, a meeting with the head of the school to kind of get in touch with the training of teachers, what is available, and making sure that Libby qualifies for appropriate services. I feel like it's also important. I feel like in a school environment, sometimes services can be pushed aside for children within Libby's case, and really advocate for push-in services. I feel like that is something that really would allow Libby to connect with her peers and form long-lasting friendships. Again, school teachers, connection with school teachers, and then family practitioner, if there's anything to add with the family practitioner, and other illnesses that Libby may have endured at different ages. So first, the cultural and linguistic biases. On our next slide, I have the parents' beliefs towards the modalities of ASL. That's something that we're going to run into, because I know that in the video, the parents weren't very keen on ASL, as I feel like it was more so something that it was hard for them to take note of and kind of form a personal connection with ASL, and learning it too, and taking time out of their day from their work and caretaking is a lot, and it's a lot on the family, but offering encouragement and support through that is our main priority. One of our main priorities, I should say. Also, the beliefs of Libby's team. Touching on biases from everyone involved in caretaking of Libby is very important as well. Each person is going to hold different biases, and when we come together as a team and talk about our biases, it allows us to provide more in-depth care in Libby's direction. I'm talking about the SLP, ASL teacher, audiologist teacher, just like some examples of that. Just everyone on her team, the team that I've talked about before, that multidisciplinary team. Libby's beliefs and values towards her own personal communication efforts. What does Libby want? I feel like this gets left out of care so often than not. I know she is young, but she still has a voice, and let's allow her to use it. Let's touch on how she feels within her own care and learn from it. I feel like that's very important. I feel like with kids Libby's age, we kind of brush over this aspect, but I feel like it's important to kind of go about it in a very light way, and kind of receive some input from Libby of what she thinks. That's very important. I mean, it's her care, but I know some people, this isn't like their main priority. Their main priority is just kind of treatment. Then they kind of push past the whole aspect of involvement of the client themselves, regardless of age. The familial beliefs as a whole, including the family dynamic with the siblings, the mom, the dad, and the overall dynamic of the social relationship of that family. The biases, and then the linguistic and the cultural variables that come with that. And then the school environment, what's happening in the school environment, Libby's friends and relationships with teachers and peers. These are all very important, and especially when we're learning ASL in a predominantly verbal spoken school, a mainstream school. That's something that to consider too. Again, the socio-emotional factors of this goes a very long way. Up next, so I have biases in familial schedule. I feel like this is really important. Another bias to touch on, the familial environment and the overall family dynamic day to day and how it affects Libby's progress within treatment. In the beginning, the parents believed that Libby was not picking up ASL, and they kind of just really wanted nothing to do with ASL in the beginning. And I feel like, personally, me speaking on this, there's a couple of reasons behind that. But if I was coming at this in a more professional way, I would kind of let that sit on the back burner for a little bit and offer encouragement and offer my services and my knowledge on this and how important it is for Libby to gain language through ASL, to gain an understanding of ASL as a language. We've seen progression within her therapy, and when we find progression as therapists, let's push for it. Let's push for it and let's accelerate that so she can get that valuable language learning that she needs, because we have to understand that she's already behind, so we need to get her caught up, whether it's ASL, and then we can do dual therapy as well. We can do ASL and we can do spoken and verbal language with speech therapy services. If that's something that the parents want to push for, we can get the audiologist involved and see how we can aid the hearing aids with different systems and different environments to really make that therapy experience heightened within all environments of Libby's day-to-day life. So that's just one thing that I think is really important, is touching on the familial bias. Parents may feel too busy or nervous about learning ASL, and that's something that I would kind of bring up later in a very late manner, but also bringing attention to it. And we'll talk more about that later in the video as well. Also, I've come to find in the video that the mother initially did not tell the ASL therapist and the ASL therapist the entire truth about Libby's case history with her being hard of hearing. Is that the dynamic of the family is a little bit different, and step-parents are actually involved, which is something that I would know completely nothing about if I was not observing the situation as a third party, or if I was in the situation. If I was in the situation, I would know nothing about this, but looking at it from a third party perspective, that does change a lot of aspects about it, knowing that it's in their family case history and it's in their family line that there is a history of hearing loss. And I feel like that was very interesting to hear in the video when the nanny, I can't remember her name, who teaches Libby ASL. I think it's really important to note. But again, it's also very important to note that me as a third-party observer would not have known that if I was in this environment providing my services. But I think it's very interesting. And it just kind of says a little bit about how the family dynamic is going, if you know what I mean when I say that. And they kind of like the relationship, I guess, the relationship between family and practitioner, and that kind of said a lot to me about that. But we'll push through it in the hopes of success, in future success for Libby. The siblings have noted that Libby has been picking up ASL, so there is valuable data to show that, and the siblings and other members of the family have seen progression in Libby's treatment, and I feel like that is something to celebrate instead of kind of shoving it in a corner and putting a label on it before we can actually put a professional label on it. And track that data and keep that data up front and center to track her progress. We need to track progress. We need to see how good she's doing over the course of months, weeks, and days. And I just feel like this, and I have my example in here, is signing, I think it was signing for OJ at the breakfast table is the thing that she did, and that's when everyone noticed that she was doing it. And I feel like that's so important to highlight. Like, she is communicating in what she sees as the best way to communicate and what works best for her, and we need to highlight that and take that and run with it and use it. She's feeling comfortable to communicate in a way that she sees best fit for herself, and we have to support her through that. We have to give her all of the support necessary to scaffold her, to get her to a point where she can communicate fully independent and honestly with the help and the environment around her. And then again, just overall, I feel like there's a lot of biases in this video, and a lot of hoops that we need to jump through in order to provide clean-cut Monday, Wednesday, Tuesday, Thursday type care. But there is a couple of hoops that we have to jump through to get to that point of that smooth sailing of therapy. I mean, not every therapy is smooth sailing, but to get to that leeway point of like where we know what's going to consistently happen through the data, because we don't have the data yet. I mean, she's still so young, but even at that age, we can collect very valuable data on her language progress. So, and that's what I want to get. That's what I want to obtain from all members of the team. I need to know data on hearing. I need to know data on language learning. I need to know data on ASL learning. I need to know data on familial involvement. I just feel like I'm at a lack of understanding within progression and familial involvement, and that's why I consider this to be a very big bias and a lot of hoops to jump through with the bias and the familial schedule, because they're also very busy. They're a very busy family, and I feel like there's gonna develop a lack of connection unless we can get some valuable communication and repair that communication that's been lost for the past however many years. Is very important. So up next is the plan. So for the beginning of my plan would be the continuation of services in-home. I feel like this is so very important, and we're going to dual wield this with services in the school and allow them to work in tandem with one another to really, really attack therapy from all ends and make sure that she's getting comprehensive care and dynamic care. Continue in-home services with ASL multiple days a week. Give them a lesson plan, give the family a lesson plan, and have the therapist there however many days that she's available. If she's available throughout the week, that's great. We'll continue those services. But if we have to cut back services for whatever reason, have a lesson plan for the week and have familial involvement within those lesson plans. I think it's very important that the family is included within the therapy so we can all learn ASL as a team unit. And that's even good for connection as well. So I have inclusion of the family at ASL, a home plan and lesson plans for when the therapist is not present. In-home speech and language services too. We can push in services in the home. I feel like if the parents want to do an approach of really targeting verbal language, that's something that we can do, but we also really need to work in tandem with her hearing loss. It's something that's so important if we really want to tackle verbal language. Again, talking with the multidisciplinary team, getting that data through and through for an understanding of our next steps forward. But beginning with an in-home services is so important. It's so important for connection with a therapist, building rapport with a therapist, building, that foundational language learning, if that's the route that we need to take, but also the ASL learning as well. She had a lot of good liftoff with that in the initial baselining of her language learning with ASL, and I think we've got to keep going with that. We have to give her supports, and that is her main support right now. If she was only relying on lip reading for communication, that is not sufficient enough. In my mind, as an SLP, I can't let that slide. Let that be her only form of communication, and not being able to express what she needs and wants. I just won't let that slide. Again, work in tandem with school services, SLP, and ASL interpreter. So school-based services, again, working in tandem is my main goal. Setting similar goals, but also different goals at the same time, so we can tackle multiple targets while not overstimulating Libby at the same time. Because she's a really young girl, so we don't want to burn her out, but we also want this to be comprehensive and sufficient enough to tackle these language learning goals. So Libby should be receiving services from a school-based SLP and ASL interpreter, period. I feel like that is so important, and I am going to advocate for push-in services and push-out services if we need time away from the classroom to really connect on those goals that we have. But allowing push-in services to happen will make for a more well-rounded environment for Libby to form connection with her peers and long-lasting relationships. And this would allow her more encouragement to progress in therapy when she has those bonds made with friends. I think that is so important. I think that is a major part. And honestly, even doing social pragmatic language as a goal, I feel like that would be very, very helpful towards language learning with her and her friends. Because I'm going to talk about that in a little bit, where it's if Libby's friends or peers in the school desire to have more of a connection with Libby but have that lack of that communication, we can repair communication. We can offer ASL, like little ASL classes with Libby and with her friends, and make it something that's communicative and friendly and easy to learn and step by step, and allow for bonds to be created. I think that's so exciting, and we can do this outside of the therapy routine too. I'll talk about stimulating environments, learning outside the classroom in the home later, and I think that's where we should do it. I feel like that would be really, really good to progress relationships and friendships. I feel like that's so important. Connection with peers can allow for more in-depth language learning and pushes Libby further in therapy practices by instilling more encouragement. That is all that I'm talking about right there. Also ensuring access to appropriate classroom accommodations. FM systems, connect those bad boys with her hearing aids, boom. Depending again on thresholds and where we're at with her hearing capabilities and how well that's going to work. I don't know the exact numbers of that yet. But if I were to get that data, we would be pushing for it. We would be pushing for all the classroom accommodations so she can maintain her education at the same rate as her normal developing peers. Oh, it's just so important. Ensure teachers have proper training. Just ensure that they know how to help Libby the best way that they can. And I'm going to make sure that happens. because there's lots of extra trainings that teachers can do to become more aware of the learning environment that's going to work best for Libby. I just feel like that's so important. Again, here we are. Social emotional well-being. This is so important. Everything is important. I think it's my favorite word. Keep Libby involved in her therapy. I think this is so, I'm going to say important. I know she's young. I talked about it earlier, but asking her those simple questions. What does she like? What does she dislike? This will allow us to cater therapy to progress her treatment. If she doesn't like something, we can change the way that we put it in front of her. We can change the way that we prompt her in different therapy environments. If she doesn't like learning a specific aspect of ASL, we can change it. And we can attack something else and throw that in with it that she likes and use it as reinforcement. Take what she likes as reinforcement and use it to reinforce the aspects of learning that she doesn't like. And that's something that's always going to work with kids. Find the reinforcer and use it to prompt language. Encourage self-discovery and identity. Libby is different than her hearing peers. We need to encourage identity of self. And at this age, this is where it's going to start formulating. And I feel like that's why I really kind of want to have a really good basis and baseline in social emotional well-being. Because I talked about in my PowerPoint, if there is a lack in well-being after 3 months' time, stuff needs to change. Aspects of her plan of care, goals, who's treating her. We need to do a whole factory reset of what's happening with Libby's care. If we are not seeing progress and we are not seeing goals met, we need to change stuff. We need to make sure that it works for her, and we need to make sure that it works for the family. We need to make sure it works for her. We need to make sure it works for all of the practitioners that are providing her care. Everyone needs to be on the same page in order for her to thrive. And I feel like that's so important, and if it is not working, we need to change something. Again, let's begin to track the good days and the bad days. If we're seeing more bad days than good days, there's our first indicator that stuff is not working, and we need to change what's not working. I also added in here family counseling with ASL interpreter. I know that I talked about the biases, and the family just seems so busy all the time, and I just saw a lack of connection, and the buildup of communication was not there. And I feel like allowing the family to take time for themselves to sit down with someone to talk about their emotions and their feelings, and it's stressful. Understanding that someone communicates differently from you and you don't know how to attack it, that's stressful. And we need to make sure that everyone's emotions are on the same page and they're out there and they're talked about, and you feel safe to talk about these things too. I feel like that's so important to feel comfortable to talk about what's going on. Everyone needs to talk. Everyone needs to feel comfortable. Everyone needs to feel safe. And I feel like once we get this going, if it's a potential possibility, I feel like it will allow more language learning, more communication repair to happen within the home specifically. And the school environment. Again, here we go. Stimulating learning environment. I feel like this is also, I want Libby outside of school. I want her outside of the home. I want her running around being a kid. That is where children learn best from experience and taking the leap of faith that they need to learn to make decisions. I feel like language learning outside, in the video I saw her and her ASL teacher doing ASL just on the bench, like getting out of the house, even sitting on the bench outside your house. I love to see that. It's dynamic, it's changing. It's allowing her to get perception of the world, and that's what we want. Keep doing that. I love it. I love to see it. Embrace deaf culture. OMG. Embrace deaf culture. Come on. Encourage, build, provide. Here we go. Encourage the family to attend deaf clubs, meetups, cultural events to immerse themselves in the deaf community. Libby has a hearing impairment. We need to embrace it. We need to embrace it. And this is where we're going to catch that rift of differences in identity between hearing people and people who are hard of hearing or identify as deaf. And we need to embrace culture. Again, she's forming her identity, and this is where it happens at that young age. It is a foundational period for language learning and building of identity. We need to make sure that we are allowing her to explore within the deaf community and meet new people. Again, build relationships with deaf mentors who can guide Libby and the family. They're in a period where they don't know. They just don't know, and what you don't know can be scary. And I feel like allowing someone to come in and teach you about what you don't know allows you to not be scared anymore. It's simple as that. Once you have a foundational knowledge of what you didn't know, and now you know, it's so warming and it's so welcoming. And I feel like we need to embrace it. Allowing, and then even talking to the school system about providing workshops and allowing and getting the community involved, allowing outside resources to come into these small communities and build rapport within the community with deaf culture. I feel like that could be great. Allowing the kids in the school to understand what being deaf is and what being hard of hearing is and what being different is. Because just because you're different doesn't mean that you're any less from your peers. And we need to teach that early on. At the end, prognosis. After reviewing that, I feel like Libby's prognosis is very good once we're going to start treatment. Once we get this baseline data down, I feel like her prognosis is very good based on her engagement. I've seen her engagement within the video. It's very good. She loved learning ASL. Her engagement is awesome. It's awesome. Engagement, previous progress. Again, her progress was through the roof. She was learning language. She had no basis of language, and then she had it. We are on like the third stepping stone. Up, down, up, down. Well, we're shooting for up. And a familiar support, the support's there. We just gotta work on that a little bit. And then desire for success. Everybody wants success at the end of the day, and I feel like that's what's gonna take us to a new level of language learning. And that's all I got. Thank you for listening.